Yes. Sublingual, what's that, Millie? Yep, sublingual, absolutely. But you're going to give 3 5 minutes apart. Absolutely, Paige. Absolutely. And it's very important. Now, if your patient's at home or you send them home on nitroglycerin or having had an MI, the first thing you're going to tell them, of course, is take that first one and call 911. You're not going to want them to watch their watch for 4.5 minutes or 3 minutes or whatever and then pop that next one in their mouth. The first thing that you're going to ask them is to, when they're experiencing chest pain, take one and call 911. So, what is it that nitroglycerin does? How does it affect your heart? What is the indication or action? It dilates the vessels. Absolutely. Absolutely. Because what it does is the reason why you're having the chest pain is because your cardiac cells are void of oxygen. So what it does is it vasodilates and opens up the vessels to the oxygen it needs. So what are some side effects that you can expect from nitroglycerin? What are some expected side effects? Headache, absolutely. Headache, dizziness. Some people get a little nauseated, but not often. And so, one of the things we'll talk about when we get to the cholesterol is the fact that high cholesterol can actually precipitate an MI. You have those little clots that break away from the side of the vessels, and we'll talk about the parameters of HDL and LDL in a little bit for sure. So, therapeutic actions, of course, relaxes the vascular smooth muscles, and with a resultant decrease in venous return, decreases arterial pressure, and reduces left ventricular workload. So, what it really does is that when it dilates those vessels, it decreases the workload of the heart, which means that the cells in the heart muscles need less oxygen. There are a couple of ways that you can give nitro. What's one more than sublingual? Because you have sublingual, it comes in a little brown, um, right, patch. Absolutely, absolutely. Transdermal, absolutely. That's called a patch for sure. And so when you're preparing the site for the patch, what do? You clean it, right? If there is hair, of course, you make sure it's dry and clean. You want to maybe even shave the area. Certainly put on gloves when you put on the patch. There are some patches that look like a sheet of paper, and the nitroglycerin comes in a tube. And on the patch and on the sheet of paper, it's measured out in centimeters. And so sometimes the prescription for that particular drug will say 2 centimeters once a day. So then you measure it out on that. The patch has a little ruler on it, and then you just measure it out and put it on the patient. But you absolutely, absolutely have to wear gloves, because certainly you don't want to get it on your fingers. When I was in nursing school, one of my colleagues um, put it on her finger and was watching it, and she passed smooth out. So yeah, you absorb it in your skin, which is why of course, I'm not quite sure why she would put it on her finger. But anyway, I don't know. Who knows? So anyway, she put it on her finger and passed out. So don't do that. That's not a good maneuver for clinical. So certainly we talked about it's indicated for acute angina, and certainly prophylactic for angina as well. There's another particular form of nitroglycerin that is a pill form, and sometimes it's given for people that have chest pain. What's the difference between sublingual and transbuccal? Do we need to know about transbuccal? Well, anything in the mouth is no. Anything in the mouth is absorbed very rapidly. Of course, the skin, it's going to take a little bit longer. A lot of times, the skin, when you're given it transdermally, it's used on a daily basis. And certainly, anything that you give PO with first pass effect, is something that's taken regularly, mostly as prophylactically. A lot of the patients will have heart failure, and when their heart begins to work overtime in order to help them experience quality of life and or um, able to navigate the activities of daily living, they develop chest pain simply because their heart is not only worn out, but because of heart failure, it can't get oxygen to the cells. And so they just are on a nitrate that's a daily dose, PO and oral. Uh, let's see, do we need to know? Okay, all right, we're good. So let's see, we talked about nitro, cleaning the skin. I'm trying to read my own notes here. So pharmacokinetics, of course. Let's see, is that the next page? Transdermal, of course, takes a little bit longer, anywhere from 30 to 60 minutes. Indications, of course. Wait a minute, where's this? Hang on, my pages are stuck together. Nitroglycerin. Okay, so there's a beta blocker called metoprolol. Metoprolol can also be given for stable angina. It can be used certainly in the treatment of hypertension because it is a beta blocker, but it's also used to prevent a repeated MI. Certainly it can be done in long-term management of any sort of treatment as well. Diltiazem. Diltiazem is, what class is diltiazem? Does anybody know? It's Norvasc. It's a calcium channel blocker. There you go. Absolutely. Thank you, Michelle. It's a calcium channel blocker. It prevents or inhibits the movement of calcium along the membranes and certainly allows for the arterial muscles to alter their action potential, which means, of course, that they're able to relax and not exhibit the excitatory phase that goes along with trying to force blood against a pressure gradient, as in cardiac output. And basically what that means is all it does is reduce the oxygen demand for the myocardium or the muscles. And in essence, it also helps to relieve the vasospasms. So if the heart is having a decreased oxygen supply and the blood pressure is high, one of the actions of a cardiac calcium channel blocker is it allows those smooth muscles to relax. It allows blood to flow more freely to the cardiac muscles, and it also relieves the vasospasms that are occurring in the arteries. So let's see, considerations for the older adult for anti-anginal drugs. What do you think is important for the older adults for anti-anginal drugs? Hypotension, absolutely. Fall risk, absolutely, absolutely, because they make you dizzy, especially nitroglycerin. They make you hypotensive and dizzy, that's for sure. They're more likely to develop adverse effects associated with the use of these drugs, hypotension, arrhythmias as well, and certainly congestive heart failure. Older adults are also more likely to have renal and hepatic impairment from the underlying medical conditions, which can certainly respond to how your system is trying to get rid of these drugs. Because remember, a lot of these drugs are metabolized in the liver and excreted through the kidneys. Most of the time, of course, older adults should be started on lower doses, and certainly patients should be monitored very closely. We talked about how do you store these drugs like nitroglycerin. It has an expiration date. It's stored usually in a brown bottle that needs to be kept in a cool and dry place. Sunlight affects the efficacy. And one way you can tell about the nitroglycerin, particularly in the sublingual form, is if you give your patient nitroglycerin and they put it under their tongue and it doesn't fizz, then it's probably out of date. That's one of the key indicators that it's out of date. Yes, it will kind of like, do you remember those little kind of, anybody remember Pop Rocks? Yeah, there you go, Pop Rocks. Yep. My kids used to eat them in applesauce. So it has kind of that like fizzy sensation. Now, I'm not saying that from experience. However, hey, Dr. Starkovich, I'm not saying I tried, applesauce. Pop Rocks, not nitro. Pop Rocks and applesauce. Well, it came in a pair, like, when they were trying to peddle candy to your kid, but they want you to eat something good. So they attach candy to fruit. Yeah. And because I had 3 of them at one time, I bought them. I would think it would be a good thing to warn. Yeah, absolutely. Absolutely. Yeah, I was not that smart as a parent. So let's talk about topical nitro for just a minute. One thing that you have, what is one thing to remember about putting a patch on your patient? Any patch at all. This will come into play whether it's a pain patch, a nitro patch. Take it off. Yep, absolutely. Take it off at the same time, but don't put 2 on at a time. Take one off, put one on. Yes, and usually daily. Some of the pain patches are left on for 72 hours, but you always make sure you date them and time them. A lot of the narcotic patches need to be disposed of in a specific container that has a biodegradable kind of liquid in it. It's people have been known to pull them out of the garbage can and chew them. Old patches with lidocaine in them, and yeah, oh my goodness, Kara, yeah, Millie, it is gross. But people who are taking and selling drugs, well, yeah, oh yeah, absolutely. Those patches are very very addictive. Certainly, codeine is nationwide one of the drugs that have the most amount of addicts on it, besides, of course, beer. Let's see. Avoid erectile dysfunction drugs when you take nitroglycerin. And by the way, remember this for next semester too, because that'll be one of your Pharm 2 exam tests questions. Remember, rotate the sites, check the skin for breakdown. Always work.
Quick question about that. On the study guide, it says, why should male and female clients be asked about their use of ED medications? And I couldn't find a good answer anywhere.
Well, because women and men take them. The biggest part about it is they give you, they cause profound basal constriction, and irrespective of who takes them, it could have an untoward effect on your cardiac involvement. It's not so much as far as the erectile dysfunction drugs. It's not so much that the expected result is realized, but it's more that the untoward effects of the cardiac system and on the increased vascular pressure in your head, which is why when you have a buildup of pressure in your brain, you are setting yourself up for the potential of a stroke, certainly a hemorrhagic stroke. So while women do take them, and I'm actually not sure how they work. Maybe Dr. Starkovich could be an expert. Um,
I guess that's kind of what I was trying to, that's where I was confused, because I guess I don't really understand why or like what purpose it would serve for a woman to take an ED med.
Well,
I've heard
the
that
primary
people take
purpose-
Viagra as like a party drug.
yeah.
Well,
Yeah. I mean,
the
it's,
primary purpose, sorry, the primary purpose of ED drugs was initially for blood pressure. It just had an interesting side effect that would make people a lot of money. So I don't know if that answers that question.
yeah, and there's limits, there's some benefit sexually to women taking Viagra or Sudafed, but like Dr. Starkovich said, it's one of those drugs that was actually intended for blood pressure, but the side effects were not the adverse effects. So it's kind of like a drug called Rogaine. It was also developed for blood pressure, but one of the side effects was it caused increased hair growth for men with male pattern baldness. So a lot of these drugs that are placed on the market are placed on the market for their side effects and not their intended effects. But unfortunately, when you take them, you also experience their intended effects, which in this case has to do with blood pressure. Does that make sense?
Yes, that
Makes
does.
sense
Thank
to
you.
me.
All righty. So we got that conversation out of the way. And indeed, so a man with orthostatic hypotension yeah, and a lot of it depends on also on what other comorbidities they have. Because Viagra can cause orthostatic hypotension because it's actually more commonly known as the low blood pressure. Because what it does is it shunts blood to other spaces than the heart. It reduces the blood to the vital organs because it's intended for other concerns. Let's see, just wondering how many people took Viagra as a party med and passed out. Probably a lot. Probably a lot. Because usually if you're at a party, you're probably having alcohol and maybe other things. Alrighty then. So nitroglycerin, what are some of the side effects of nitroglycerin? Flushing, absolutely. Sublingual nitroglycerin relieves chest pain within 3 to 5 minutes. You take 1 to 2, of course, and then of course, if it's not sweating, if it's not relieved within 5 minutes, of course, you take another. If the pain continues, you take the third. Only a 3 tablets, merely absolute dizziness. You tell your doctor, certainly if you're taking the drug, especially if you go in the emergency room, keep this drug and all drugs out of the hands of children. Avoid alcohol, of course, because alcohol and nitroglycerin, like alcohol and just about anything, can cause serious trouble. Always monitor. Anytime you give anything that affects your heart, always monitor O2 sats, blood pressure, vital signs, and chest pain. One thing that you want to always ask your patient if you're giving them any kind of nitroglycerin, is you want to ask them about their chest pain. That's kind of the go-to level question assessment on chest pain. So we're going to segue into, does anybody have any questions about Viagra or nitroglycerin or any nitrates? Sometimes people keep nitro in the fridge, just saying. Good topic, good questions, guys. So we're going to segue into anti-cholesterol agents. So one thing we remember is that the reason why you have HDL, because HDL absorbs cholesterol and carries it back to the liver, which makes it a very good cholesterol, which is why you like your HDL to be higher, because it gathers up the cholesterol in your body and it totes it off to the liver to be metabolized and excreted. Does anybody know normal HDL or LDL? So you want your HDL to be what? Greater than? Okay, I had 40, but maybe 60 works. You want your LDL to be less than 100. Which is the worst, LDL or HDL? Yes, LDL. Because your HDL is a good actor. Your LDL is a bad actor. So your LDL is what causes the increased risk factors for MI. A lot of cardiovascular complications are caused from increased cholesterol. Certainly anything greater or equal to 160 is a high risk for morbidity. We talked about, let's see, let me go to my cholesterol stuff. Change tracks here. So anytime your patient is on cholesterol medications or statins, they're called HOA reductase inhibitors. And certainly what they do is they interfere with the ability to produce cholesterol from fat, because they inhibit cholesterol formation in the cell. Now, statins have their own set of problems. Statins were actually developed as a very short-term course for hypercholesterolemia. Unfortunately, people continue to take them because the goal of giving someone a statin was to give them a margin of error before they fixed their diet and adopted a new lifestyle, like maybe even exercise or not smoking. Smoking is terrible for cholesterol. It's one of those things that also can increase the cholesterol levels. Indications and actions for these statins. There are a couple of things that we will talk about. One, of course, is niacin, lowers cholesterol. It B3. Have you heard of the niacin flush? Did anybody like get into the heavy exercise period where you would take some niacin and then exercise? Because what it does is it vasodilates and you get this what's called a niacin flush. And it's extremely people that are on like fasting and, 75 hard and gladiator sort of training. Anytime anybody's professional athletes do this as well, they take the niacin and then they exercise, because what it does is it depletes their system of all of the cholesterol, and it allows their muscles to develop more rapidly. Hypertrophy of the muscles develop more rapidly. But anyway, if you hadn't done all that, it's pretty interesting. But niacin is one of those particular drugs that causes the flush, basically because it is helping carry the cholesterol to your liver, which of course gives you that increased ability to produce muscles. One thing that you want to remember is that anytime anyone has hypercholesterolemia, You want to make sure that they really control their Tylenol intake. Remember, we talked about Tylenol is really rough on the liver. Speaking of niacin, niacin is one of those drugs that some of the side effects, other than facial flushing, are also itching and even decreased blood sugar. So remember those things, even though they're natural and or over the counter, and certainly supplements that you can even find in low volumes in natural food. You want to make sure that when your patient is taking niacin for cholesterol, that they may have those side effects. There's another drug that we'll talk about, and particularly on your exam. It's a drug called cholestyramine. What it does is it reduces serum cholesterol in the patients through the gut, because the cholestyramine, what it does is it binds with the bile salts in the intestines, and it allows the cholesterol to be excreted in the feces. Certainly cholestyramine, unlike statins, which are prescription drugs, are not absorbed systemically. So that's a good thing. They don't have any systemic effects like statins do. Let's see. When someone is on cholestyramine, because it can cause constipation and dehydration as well, you always increase fluids and fiber intake. Let's see. We talked about statins briefly. When your patient's on statins, also make sure that they don't ingest a lot of alcohol, because certainly alcohol and statins are a combination for the perfect storm for liver problems. But also have so what point would you both use them together? Anytime drugs are used together and they have side effects, particularly these two, anybody with any sort of renal injury, you would not use these in combination. Anytime you have a combination drug, it's only recommended that you use them in the most optimal of situations. Like Tylenol. If anybody has liver issues, you would certainly not recommend them to take Tylenol. So these two drugs are no different. Absolutely. Absolutely. Particularly somebody that has, see, when your liver is compromised and drugs are metabolized in the liver, you don't ever really get rid of that drug. So that drug keeps circulating in your system. And even like if it's digoxin, or if it's another drug that has side effects that could affect your central nervous system, these drugs keep circulating in your system. If it weren't for your liver metabolizing these drugs, the half-life of some of the drugs would last a very long time. And then your kidneys, of course, have to work to excrete most of them for sure. Does that make sense? And so, Paige, the particular drug, simvastatin, and I can't pronounce that drug, azitimbi, they're mostly an adjunct to diet and exercise to lower cholesterol. The particular drug, azitimbi, is one of the ones that's given if the cholesterol problems are not that high, or hypercholesterolemia is not that elevated. It can be used as an adjunct. Certainly, it lowers specific cholesterol proteins. It works to, particularly in the small intestines, to block the absorption of cholesterol in the gut. So it's kind of one of those boutique drugs that I actually haven't heard used that much. I'm not sure if Dr. Starkovich has, but I haven't used it. I haven't heard of it being used that much.
No, me neither. I don't think I've ever used it.
Yeah, I certainly have never used it, but I don't think I've ever given it in like 40 plus years of being a nurse. Let's see. One thing you want to check prior to giving statins, you want to check liver enzymes. Um, you want to make sure that it's taken at night. You want to check renal function test, liver function test, and certainly lipid panels. The key points for teaching, like I just mentioned, take at night, liver function and renal function tests. Let's see, your patient, particularly the Asian populations, are at high risk for hypercholesterolemia. Some of the following adverse effects: headache, blurred vision, nervousness, insomnia. One of the things that statins cause is a condition called that has to do with your muscles, myopathy from what's it called, rhabdomyolysis. One of the things that some of the side effects of rhabdomyolysis are dark urine, sudden muscle pain, and very light colored stools. The statins are at a high risk. Your patients that use statins are at high risk for rhabdomyolysis. If your patient begins to have any of these symptoms, always check a creatinine kinase. Creatinine kinase is a very specific blood test that tests for muscle damage. One of the patients, when I taught it, actually a student, one of the students, when I taught at Texas A&M, that was when the big thing came out for like doing what is it? Not triathlons, but when you do like very focused exercises and you don't quit. Anyway, he had just gone to do whatever this exercise routine was, and he walked in my office and his muscles were swollen and he could barely walk. And I sent him immediately to the emergency room, because what happened was, if you tear down your muscles too quickly, the byproducts of muscle cells breaking down is rhabdomyolysis. And what it does is your liver can't clear the creatinine kinase, and you can go into sudden shock, and certainly sudden death. So that's all about rhabdomyolysis. Just remember, when your patient is on statins, you check renal, liver function, lipid panels. One of the drugs that is a statin is Crestor as well. Certainly check creatinine kinase and watch for dark urine, sudden muscle pain, and light-colored stools. Let's see. I mentioned this earlier as far as statins and smoking, or anti-cholesterol drugs and smoking. Considerations for adults that use anti or lipid-lowering drugs: no smoking, absolutely. Lifestyle changes, dietary restrictions. Remember, statins are not a free ticket to eat whatever you want. Stress reduction. Anytime anyone is placed on these drugs, always check baseline lipid levels. The HMG CoA reductase inhibitors, which is a statin, they're the first-line drug for hypercholesterolemia, especially for those patients who are at high risk for or have already developed coronary artery disease, which is kind of why these two topics cross over and go very well together in the same conversation. They're well tolerated. They're less expensive than other anti-lipidemic drugs. Sometimes they're actually used in combination with a biosequestrant, which was the cholestyramine, a fibrate, of course, or niacin. Certainly, it's better to use a lower amount of the statin if you can supplement it with cholestyramine and or a nitrate. Women of childbearing years should not take these reductase inhibitors. They're pregnancy category X. Biosequestrants or cholestyramine are the drug of choice for women of childbearing years if their cholesterol is needed to be lowered. Gemfibrozil is a fibrate. We talked about fibrates at bile acid sequestrants. Fibrates are like cholestyramine. A fibrate is like a gemfibrozil. It dissolves, it lowers the cholesterol as well, but you must use it with caution if you use it with statins. Gemfibrozil is kind of an off drug that I haven't seen used that much. Is honestly one of the reasons why people recommend the statins is because they seem to have the longer shelf life for people, even though they were only intended to take for a short amount of time. Let's see. I've talked for 40 minutes nonstop. Remember, total cholesterol is anywhere from 125 to 200. LDL should be less than 100, and HDL should be greater than 40. Let's see. I talked about alcohol and statins. Let's see if I missed anything from my notes. Talked about getting liver enzymes prior to starting these drugs. I don't know, Dr. Starkovich, did I leave off anything?
I don't think so. I think you covered everything. I was a couple minutes late. Did you talk about nitro and when to call 911?
I did.
Okay.
But we had a couple of people come in late. We could certainly talk about it again.
Okay.
So when do you call 911, Paige? Jasper, Lee? Yeah, if you're not at the hospital, absolutely. Of course, I had one of my residents in the nursing home call the hospital, call 911. She had chest pain. She got a nitro. She called 911. She must have been in one of my lectures.
Oh, that's funny.
Never trust those night shift nurses. Just kidding. Yeah, we talked about 911. We talked about, sometimes it's really hard, and I've been a nurse before, doling out nitro. It's really hard if somebody has, Paige, stable angina is angina that you don't have chest pain. So if you're known to have a history of angina and it's stable, that means you're treating it prophylactically. Unstable angina is when you have unstable angina is when you have excruciating chest pain. The problem with unstable angina is it's unstable. And if your patient is taking a statin and they're having angina and they're at home, the best thing for them to do is to call 911 after they take their first one, because their angina is very unstable and you never know, what they've had that day, what's been going on in their life. It's kind of like if your neighbor calls you and says, hey, Paige, I'm your neighbor. Hey, Paige, this is Debbie. My child just fell out of a tree and he hit his head and he's unconscious. Will you come see what's going on? What's the first thing you're going to do? Paige. call 911. Absolutely. Absolutely. Oh, no, that's good. Michelle, you're fine. Because when you are giving your patients instructions and they're going home, you really don't know what's going to happen. So after they take the first one, they need to notify someone. Even if 911 gets there and they're fine, especially for people that live alone and have no caretakers. Does that make sense, Paige? The question is about patient after receiving and still have chest pain, but that patient shouldn't be calling the clinic. Oh, calling the clinic. Yeah, absolutely. They should call 911. Absolutely. Good point. Very good. All righty. I gotcha. I don't blame you. Yeah, some of this stuff's pretty confusing, especially sometimes I get on a roll and then I might say something crazy. Don't get crazy.
Well, it kind of depends too, if you have a cardiologist that you've got a pretty good relationship with, you might be calling the clinic.
Yeah, if it's
But
office
if it,
hours, for sure.
yeah. But the thing with MIs is you really need to act quickly, and 911 is a mobile hospital, right? And basically. So you're gonna get the care on the way to the hospital that you need. And if your chest pain resolves with your, 3 nitros, 2 maybe while you're in the ambulance, that's fine. Maybe you go home and follow up with your cardiologist, but it's better to be safe.
Yeah,
If
for
after
sure.
the first one it doesn't relieve the pain.
Absolutely.
Yeah, and definitely make sure you don't throw it in the trash because it's flammable. So it needs to go in the black box. I don't know if you said that or not, but
Oh, I didn't. No, that's a good point.
I'll throw that in there. Yeah, it's flammable, so it needs to be disposed of properly. Um, Whether it's the patch or the paper or whatever, it shouldn't go into any trash that's going to be incinerated because it's flammable unless you put a label on it that says that there's flammable materials.
So then people light it and they know it's going to burn.
Yeah. It's not like, poof, woo, surprise, where'd my eyebrows go? I singed my hair. Yeah, whatever.
Yeah, no doubt. No doubt. All right. Well, we've had a very invigorating, let's see. So patient B would be off, it wouldn't be often that they would actually take all 3. Um, you know, I've had the occasion waiting on an ambulance to give people 3 of them. I have. I've had that occasion at the nursing home. So, you just, like Dr. Starkovich said, you just don't know, because sometimes the chest pain is there's a couple of reasons for chest pain. A couple of very profound reasons. One is vasoconstriction, and then the other is a clot. So nitro can relieve a good 90% of the vasoconstriction, but it can almost relieve 0% of the clot. So you have what is it, 20 minutes? Well, if somebody comes to the ER and they have chest pain, you have 15 minutes to do an EKG on them.
10
Because
to do it and get it read.
10, okay.
Uh,
And so the reason why you don't want to mess around with chest pain and nitroglycerin is because that patient could be having an evolving MI. And while nitroglycerin could palliate and briefly allow some vasodilation, if there's a clot, that's not going to resolve it. they need to have that diagnostic EKG, and they need to go to the cath lab, because you have a very narrow window to give them a clot buster. And that's another question that will be in Pharm 2 as well. It's Ataplase. You need to get in there and you need to make some very quick interventional procedures on this patient. Does that make sense, Paige? You're welcome. I love talking about, and Dr. Starkovich loves talking about critical care stuff too. So ask more questions.
Makes the class a lot more interesting too, right?
Sure does. Meets talking about the Viagra question.
I thought the Viagra question was pretty interesting personally.
Oh, absolutely. Absolutely. I'm sitting here still scratching my head why women would want to take it, but I might have to do some research myself.
You know,
I mean, I'm not going to do field trials or anything, but I just want to check it out, see why, because now inquiring minds want to know.
I was surprised it's even a party drug.
Oh, well, I mean, that does make sense to me.
Come on, tell us why.
You know, huh?
Tell us why.
Why does it make sense?
Why does it make sense?
Well, because you want to party, you want to keep it up longer, you know, and if you're drunk or whatever, or on drugs, maybe you can't get it up, you know, if you're a man.
That makes sense. I thought they're like taking it like MDMA or something.
No, I think it's to have a longer erection.
Okay.
Yeah.
Well, it
I
says
saw that
there's
on a
his
movie.
and her Viagra.
Yeah.
A what?
But
It says his and Google says his and her Viagra.
Oh.
I don't know. So like maybe it does something to females too. I don't know about that, but I'm pretty sure the party drug thing is to have a longer erection when you're intoxicated.
So Pfizer, home of the COVID vaccine and Viagra. And Cialis.
Oh, well, there we go, Millie.
That's.
Yeah, Google. Dr. Google is awesome, right? Dr. Google everything.
Says you can get Viagra from cab drivers now.
Dr. Google gives you wrong answers.
Yeah.
But that does make sense. I mean, if that's the reason you get an erection, why wouldn't it do the same thing for females? I mean, that makes perfect sense.
You mean like hyphen excitement?
Yeah, well, she said it increases blood flow to the genitals, so increases sensitivity, arousal. Yeah, so that does make a lot of sense. Yeah, I was thinking about it more like how you give BPH meds to females for kidney stones. You know what I mean? Like,
right. Absolutely.
Females obviously don't have a prostate, but
they can get kidney stones.
Yeah.
Yeah. And kidney stones are actually the most painful form of health disparity you can have, because your ureters are tiny. They're pinhole tubes. And when a lot of these kidney stones are made of uric acid crystals that are very sharp. They're extremely painful. Kidney stones are extremely painful. So
I'm taking a bunch of vitamins right now, and that's like the main thing I'm paranoid about. I'm drinking tons of water because my cousin had a kidney stone. He told me it felt like being kicked in the nuts every 10 minutes.
Mm-hmm. Yeah, you've really got to drink a lot of water, especially with vitamins and things like that are